Hello everyone, my name is Stacy Singh and welcome to Sing Primetime. Tonight's discussion is on community disparities. What do they mean for New York City? Are these disparities deliberate? Now joining me is a colleague of mine. Please join me in welcoming Stephanie Adams to the show. Hi Stephanie, welcome. Thank you for having me on the show. I know that you're very passionate about this topic, right? And you've been very vocal about it. So what I want to know is that what does community disparity mean to you? Well, I mean, to me, community disparities are the results of systematic racism. Okay, wait a minute. Stephanie, hold on. You're going to have to expand on that. What do you mean? There's a huge disinterest and disinvolvement in our vulnerable communities. And by vulnerable, I don't mean weak. I mean communities where the government has provided limited and inadequate resources to our communities of color. Resources to what degree, Stephanie? I mean resources to provide for access to better health care or health insurance, the least. Access to better and more healthier foods, cleaner neighborhoods, better schools. I mean, the list is endless. For those who will say, well, okay, where are you getting your information from? What do you have to say to them? Right. Well, I'd rather show them, if that's okay. Can I share my screen? Yeah. Okay. Well, if you go on nyc.gov and search for community profiles, right? I'm going to pull up some visuals and data here. And you can actually compare and contrast disparities in communities. For example, here's some data on the Upper East Side. Pay close attention to these numbers. Okay? Now what I'm going to do is compare it to an area like East Flatbush. Pay attention to these numbers. 88% African Americans, 1% white. You know what's really interesting to me are the poverty statistics for both areas. Exactly, that's what I mean. 7% in the Upper East Side, that is composed of 78% of white people, has a poverty rate that's less than 10%. And you included a lot of health statistics. What's the significance there? Well, the blame gets put on poor health choices, right? The government pushes this agenda that we should all live balanced lifestyles and exercise and eat right. But how can we when our parks are unsafe and unsanitary? People do not have the luxury to eat organic foods because grocery stores do not either offer them, do not have high quality foods, or they can't afford white people salads. I mean, let me not even get started on our hospitals. No, go right ahead. What about... Okay, again, I rather show you. If you Google what is the #1 hospital in New York City, this pops up. Pay attention to where it is located. Right? Look at the infrastructure. It's beautiful. There was a real investment that went into it. And then compare it to something like Lincoln Medical Center in the Bronx with a 2-star rating. It looks like a prison to me. This is a waiting room at New York Presbyterian. It's huge. It's spacious. It's welcoming. And now this is a waiting room at Kings County Hospital Center. It looks like a scene from a damn DMV. People are compacted together, sick people, healthy people. So Stephanie, what is the solution? Where do we go from here? We need to recognize and admit that systematic racism is the root of community disparities. Our current systems, healthcare system, education system, even prison systems are put in place so that our communities just become another bad statistic and an excuse for the government to provide inadequate funding. They are systems of oppression to keep us from having the same luxuries that our white counterparts have direct access to. We need to re-examine current policies. Who are these policies really helping, and is it enough? So what about these financial support systems like food stamps, rent assistance, Section 8? These so-called governmental programs to help aid low-income neighborhoods are reformative. They barely touch on the surface of the real issue. They are put in place so that the government can feel better about itself and further oppress us. I understand your point of view, but I'm not seeing how you intend on fixing this issue, fixing these disparities. I suggest we take some funding away from these rich, wealthy neighborhoods and distribute them evenly to other communities that actually need better upkeep. Invest more in providing access to medical care for people of color. White people are more likely to avoid hospitalization because they have access to primary quality care. Let's reverse this. Give the same quality of care to all communities. Use the same time, energy, and resources that we do to lock up our children, and invest in mental health programs, better schools, healthier foods, clean and safe parks and recreations. But is this reformative? Well, if we deconstruct our systems entirely and invest not on race, but through necessity, we would be moving in a more transformative direction. Hey, Stephanie, that's all the time we have for today. Thank you for joining us. Good night. All right, you take care. Okay. Oh, all right. So much to process. Stephanie, right. Are demographics the sole determinant of community disparities? Much to think about. I am Stacey Singh, and this has been Sing Primetime. Signing off.